Hello, my name is Taylor Duncan, and this is my anti-Alzheimer agents presentation. Introduction. Dementia is a progressive, irreversible decline in mental function. Alzheimer's disease is the most frequent cause of dementia. Currently, cholinesterase inhibitors and NMDA receptor antagonists are the two types of drug classes that are available to treat dementia. While these medications do not stop the damage Alzheimer's causes to brain cells, they may help lessen or stabilize the symptoms for a short amount of time by affecting certain chemicals involved in carrying the messages along and between the brain's nerve cells. Cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. These medications prevent the breakdown of acetylcholine, a chemical messenger important for memory and learning. These drugs support communication between nerve cells. Glutamate regulators are prescribed to improve memory, attention, reason, language, and the ability to perform simple tasks. This type of drug works by regulating the activity of glutamate, a different chemical messenger that helps the brain process information. Listed below are the drug's chemical name, the drug's trade name, and the drug's generic name. So for cholinesterase inhibitors, we have donepezil or Aricept. We have rivastigmine or Exelon. We also have galantamine or Rozidine. And for the NMDA receptor antagonist, we have the memantine or Namenda XR. Pharmacodynamics. So under cholinesterase inhibitors prevents the breakdown of cholinesterase in the brain that is responsible for thinking. They are rapidly absorbed through the gastro tract. Rivastigmine can be taken also in the form of a transdermal patch. Once absorbed in the bloodstream, they travel to the brain. They are excreted through urine and feces. They are also metabolized through the liver and distributed between blood cells in the liver, and they are water soluble. And for the NMDA receptor antagonist, memantine blocks the NMDA receptor subtype of glutamate receptors for preventing overactivation of glutamine receptors while allowing the normal activity. They are well absorbed in the GI tract after oral administration. They absorb in 3 to 7 hours if you're taking an immediate release, or 9 to 12 hours if you're taking the extended release. They are also excreted mostly in the urine, metabolized by the liver, and they are also water soluble. Indications and usage. Cholinesterase inhibitors are most commonly used for treating neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, and dementia. After Alzheimer's has been diagnosed, the patient should receive cholinesterase inhibitor treatment as early as possible. NMDA receptor antagonists are used to treat the symptoms of Alzheimer's disease as well. They work by decreasing the abnormal activity in the brain. They may improve the ability to think and remember, or may slow the loss of these abilities in people who have Alzheimer's disease. And they would also be used for those who cannot take or unable to tolerate cholinesterase inhibitors. Contraindications. So here are some reasons not to take these medications due to a certain medical treatment that could cause harm to your patient. And they include patients who have bradycardia, or, cardiac conduction diseases, patients on antihypertensive meds, with gastric ulcers, with urinary retention, patients with previous allergies or hypersensitivities to cholinesterase inhibitors, and for the MDA receptor antagonists, patients with hypersensitivity to memantine, hydrochloride, or any agents used in the formulation. Patients with raised urine pH may decrease the urinary elimination of memantine. Patients with increased incidence of cardiac failure, chest pain, and hypertension, and also patients with liver failure. Adverse reactions and effects. For cholinesterase inhibitors, the adverse reactions and effects are increased hypermotility, hypersecretion, bradycardia, meiosis, diarrhea, hypertension, and cholinergic crisis, also known as sludge, salivation, lacrimination, urination, diaphoresis, or GI upset, and emesis. For NMDA receptor antagonists, the adverse reactions and effects include dizziness, headache, confusion, diarrhea, and constipation. Dosage and administration. Donepezil is available in 5, 10, and 23 milligram tablets, and they are also approved to be used for mild to severe forms of Alzheimer's disease. Galamantine is available in 4, 8, and 12 milligram immediate release tablets, or by solution, or by extended release capsules in 8, 16, or 24 milligram. By oral solution, the medication is available in 4 milligram per milliliter, used in mild to moderate AD. Rivastigmine is available in 1.5, 3, 4.5, or 6 milligram capsules. It is also available in the transdermal patches in 4.6 milligrams, 9.5 milligrams, or 13.3 milligrams per 24 hours. Memantine. It is available in 5, 10 milligram tablets, or by extended release capsules in 7, 14, 21, or 28 milligram capsules, and by 2 milligram per milliliters in oral solution. These medications are not recommended for pediatric patients, and they can be administered by IV, IM, and orally. Patient education. The common adverse effects of cholinesterase inhibitors include vasodilation, constriction of the eye pupils, increased sweat, saliva, and tear secretion, bradycardia, mucus secretion in the respiratory system, and rescretion of the airways. There is no proof that anti-Alzheimer agents can halt or reverse the process of cell damage that produces the disease. These medications only treat the symptoms, not the underlying cause. It's also critical to understand that not everyone who tries these medications will benefit from the medications, and that no one can predict how they will react to the medications. Also, on the basis of how well a patient tolerates the treatment, doctors typically start patients at a low drug dose and progressively raises the dosage. Certain individuals may benefit from taking Alzheimer agents at larger doses according to some data. However, the likelihood of adverse side effects increases with the dose. Fun facts. How many Americans will potentially have Alzheimer's by 2050? More than 6 million Americans are currently living with Alzheimer's. So by 2050, this number is projected to rise to nearly 13 million.